Okay, so hello and welcome, Dr. Lau. Thank you so much for your time
Mm,
again and for redoing this
mm.
interview, as we didn't have great luck with the first one. So I really appreciate your commitment to doing this with me, despite stuff coming up.
Oh, no, good. Yeah. Yeah, no, happy
Um,
to be here. Thank you.
yeah, yes, absolutely. So my first question,
Yeah.
as we're kind of, I wanted us to talk a little bit about assessment and your ideas about assessment, as you have been a teacher and a researcher on this topic. So again, it
Mhm.
seems like a very broad and open question. I'm just curious about how you understand assessment
Okay.
and the role of assessment in the
Uh,
field of counseling.
yeah. Okay. Sure. Well, first of all, thank you. Yeah, for having me. Um, I think So yeah. So assessment. I think from a role as a content educator, I think it's different if you think about like teaching it at the entry level master's program versus maybe a advanced level doctoral program, or doctoral students versus masters. Maybe the role with teaching is 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 very important. The traditional or just the definition of assessment, and people can take it more as maybe tests and measurements or purely like a clinical assessment.
Mm-hmm.
I think that can be important to help people understand that, help our students understand that. But I think if we're to take assessment from a larger perspective, especially I think it's particularly helpful at the master's level when you help folks understand assessment from being like a key essential piece to everything we do as counselors,
Mm-hmm.
regardless of your setting. From the from or having your student or your whomever walk into your session, or you enter their group or whatever it is, and you're kind of like assessing the situation, or you assess the room, you assess your client, you're kind of making some observations, and you're using all the pieces of data to help make an informed decision or help give you information as you go through the session. So I think
Mm-hmm.
helping folks understand assessment from a teaching standpoint, I think helping students understand assessment from that perspective has been very helpful for me, and I think as a clinician that would be very helpful for me to understand it, or especially as an entry level clinician. So I think that's a big role of assessment for counselors, is maybe helping folks understand that this is essential to everything we do. We walk into any situation and we have to
Mm-hmm.
assess a number of things, not just maybe their mental state, but also looking at their physical state, their SES,
Mm-hmm.
their language abilities, all that kind of stuff. We're assessing all these pieces, and I think when you can frame it that way, it's very helpful. When you
Mm-hmm.
talk about assessment, like maybe from a research standpoint, as a counselor educator, you know, um, you think about a lot of it. Most often, in my case, in the work that I do, the research I've done, a lot of it is in the areas of test and measurement. So looking at validations or development validations and other measurement types of principles. Um, but I tend to look at assessment in that regard from a test and measurement perspective. But certainly we know that there's a lot of research with regards to like outcome-based studies or experimental designs, and we're looking at are we assessing the effectiveness of a particular treatment or a particular intervention of a particular program, something that we're implemented with our in our schools, in our clinics, in our agencies, in our whatever setting it is that we're working. So understanding research assessment from that perspective of research, how do we use this assessments? How do we use this assessment to inform our practice? And that's that research piece. How not only how are we using it to inform us, but how can we develop research to help better inform our practice, better inform our outcomes or the things that we're doing. We have a hunch this might be working. We don't really know. So obviously we have to do some research, and we can test to see maybe there is having is the things that we want to happen are happening from regard to things like an intervention or some sort of strategy that we're doing. So I tend to think of it that way from a teaching and a research standpoint, and I feel like that's central to what we do. And if we can help students understand that, I think we have better chance of success, maybe, of not being so turned off or afraid of the concept of assessment.
I think you're hitting on something really important, which is kind of the belief that the structured assessment and the measurements and the scales and the inventories is the heart of assessment, where I'm hearing from you is this less structured way of orienting yourself. Assessment is essentially like meaning making and orienting yourself as a clinician to the clinical situation. And I think you're absolutely right. We are kind of not taking that into consideration in or underestimating what we do, not putting that label of assessment. So yeah, thanks for that. I'm wondering about...
test and measurements are certainly solid. I'm sorry, test and measurements are certainly, a major piece, but sometimes we get so stuck on just that, and we forget the overall picture.
So when we're looking at this like more traditional box of... I'm sorry, we are breaking up just a touch. I think we can continue, but
are we breaking up?
We are a little bit, yeah. I know. I think it's gonna come together.
I'm happy to repeat.
No. This is Dr. Lau's second take, as he's so graciously giving time to this. But yes, technology is just a part of our life, and trying to navigate through it, I think it's fine. I am curious about what would you say if I asked you about the boundaries for counselors and counseling, clinical counselors, of using the measurements or assessment in general, kind of even in this broader spectrum that you kind of sketched out here. Yes, how can we inform our new clinicians, our new colleagues about that?
I think, when I heard you mention boundaries, one thing that popped up almost immediately was this idea of ethics, and and doing ethical assessment, or using our assessments in an ethical way, and I think one of the most obvious ways of that is we look at the different types of classifications, right? Like the test publishers will publish a test and say level A, level B, level C, or something like that, right? So knowing, making sure that we're qualified and we're doing the things that we are qualified to do based upon how the test publishers kind of define it. Right, they have a lot of tests where anybody can do it. They have some that are you need to have a graduate degree in it. Some might say right, you have to have like a doctoral level degree. Right, they have these different classifications. So I think that's one thing important to keep in mind. Right, is when we think about our boundaries, making sure that we are staying within our scope. But I think there's also some inherent problems that when I think about boundaries, in that in the U.S. at least, there's 50 states and territories that have licensure, with many of them having different requirements. There's no true portability laws. Some states may have reciprocity agreements with other states or whatnot, but there's no true national portability. So with that, we can very easily have somebody who's licensed in one state and doing a host of different types of assessments, and then move to another state where that state may not allow that person to do some sort of assessment that they were previously doing in their previous state. So that's something to be mindful of. That's maybe a larger issue with portability. But certainly, when we think about our boundaries with assessments, that's definitely something to think about. I think at the same time, we can think about how we can expand our boundaries, and I need to think of that in the sense of when we graduate. I'm thinking of like a master's level graduate. You're graduating with your entry level basic foundational knowledge and skills, and how to be a basic foundational counselor. But certainly that doesn't mean that's where you can stop, right? It's certainly, as you're pursuing your license, or after you get your license, you can always continue to grow, and you get additional trainings and learn more about this type of testing, and then do intelligence testing or whatnot if your state allows it. I'm hearing a lot about folks who are into the forensics and doing forensic evaluation. Certainly, most master's programs, or maybe any, I don't know, some might have, a course, but most folks aren't getting heavy training on forensics, and that's something that we know that a lot of clinicians are called upon to do. And provide some sort of forensic assessment. So how you can get additional training in there and broaden, and the same at the doctoral level, I think. we can think of it, when we finish our doctoral programs and your license and your practicing, etc., that doesn't mean that you stop your learning or your training either. You can then get additional training doing addictions assessment, maybe if you weren't trained in addictions previously, or how to do a family assessment if you weren't trained in doing family work. How we can always continue to broaden that while staying within our scope or our scope by law, what the law defines.
Mm-hmm.
But I think that kind of boundaries. So yes, it's very clear we have to stay within certain things, but that shouldn't limit us to say what I learned in my program is all I learned. And I can never get better. I can never expand. Or I can never
Right.
build. Yeah.
Mm-hmm. So boundaries are essentially we have this powerful guidance in our ethical in the code of ethics, in our ethical process of practice with consulting, supervision, all those things that kind of hopefully would help us stay within those boundaries of practice and with this in the scope of practice. And what would you say if I asked you about multicultural kind of aspect, to add this multicultural diversity fold or to what we're talking about? How do you understand that in the context of assessment?
Yeah, well, I think I think for a lot of us who maybe have made, multiculturalism, diversity, social justice advocacy, those kind of principles essential to our work. I think it means everything, right? It's everything when it comes to assessments, in the sense that we obviously want to be doing work that is culturally relevant, culturally appropriate, and culturally effective. So when it comes to assessments, I think there's no difference. We're taking that mindset with regards to wanting to make sure that we're using culturally appropriate assessments. We're doing, if we're trying to do like an evaluation, if we're trying to evaluate our interventions, even that, like, are our interventions culturally appropriate? If they're not, then we can expect that when we evaluate them, then we might not see very reliable, valid outcomes when you're looking at our clients or our students. So I think multicultural is very important, especially when you think about doing things relevant. Now, what does that mean, or culturally relevant? That's hard to define, right? But we have to think about from our client's worldview, and what makes sense. And if we don't know, right, if we don't know what makes sense, then it helps for us to maybe try to investigate and try to learn more. And that's also part of that exploration, that information gathering process. When you maybe you have to do a self-assessment, or they call that the multicultural self-assessment, to see how much are we really knowing, and how much do we know of our clients and our students, and how much are they willing to share with us. So I think from a cultural standpoint, that's very dominant, and that's been around for a long time, obviously with good reason. When you think about, or when I think about, like, from a research standpoint, besides or beyond the things that we talk about, like, are we using culturally relevant instruments? Are the interventions appropriate? Therefore, are the results culturally, are they taken within the right cultural context? I think you can also think about when we're developing and designing instruments, are we taking into consideration the different types of populations and samples that we're using? And lately, like, I may have mentioned before, but like some colleagues and I were looking at things like measurement and variance, and how we're not, and measurement and variance, that the most basic way to think of it is like looking at, let's say we have an instrument and we're validating it on our group on our sample, but there's maybe 3 distinct samples from 3 different distinct regions of the world. Are we looking at differences between our folks from the different regions of the world? Are we really looking at that, and are we testing for that? And what we're finding, that's a very simple explanation of it, obviously, but what we're finding is that from a counseling standpoint, like pure counseling research, folks are identifying as counselors who are conducting this research, we're not seeing too many people really really addressing the concept of measurement and variance. We see it a little bit more maybe in psychology, or educational psychology measurements, like testing, quantitative psychology, that kind of stuff. But we're not really seeing too much in counseling research. Oftentimes, we tend to see it on the variable of, say, sex or gender. We can see there a difference between how our male group is doing versus our female group, or something like that. But we're not really seeing it from too many other variables, especially, or are as widespread in a lot of our studies. So I think multiculturalism and diversity and social justice it's most definitely influence, or can definitely influence the research aspect of assessment, especially in counseling research, quite a bit more.
Yes, thank you for that. I don't think we would get too much pushback on that statement, or just the concept of, as we diversify as society, we just, that's just a necessity to consider the differences. And my next question kind of strays a little bit away. So if, and kind of goes into your personal realm. As a practitioner and as a
Okay.
counselor educator, if you could change something about the use of assessment in the field of counseling, what would it be?
If I could change something about the use of assessment in the field of counseling, what would that be? If I could change something, well, there's a lot of ways to go with that. There's a lot of ways. Um, I think if I could change, I think I'm gonna go back to my theme today, maybe of advocacy. I think I would change something like the advocacy. And I think that's higher than the field of counseling. I think that's a policy issue at the federal level, as it has implications to counseling. But I think I would like to see greater advocacy for the counseling profession and our relationship with assessment. Like maybe like I mentioned earlier, some states are saying you can be a licensed professional counselor, mental health counselor, whatever your state calls it, and you can do X, Y, and Z, and then you can go to another state, and you can move there 1 month later, and all of a sudden they're saying you cannot do assessments in these ways, or you cannot do any assessments, or you can only assess up to this level, and you can't do a psychiatric assessment or something like that. I would like to see some greater advocacy with that and say, if one, where are we on that as a profession? Are we that off on our training that some states say that you can, and other states say we can't, when majority, especially if you're in a take-up accredited program, where you graduate from a take-up accredited program, and even if not, if your program was following the core areas, we know that testing and assessment is one of those core areas where we should have foundational knowledge. So I think I would see some greater advocacy. I guess I was also thinking about maybe this is a somewhat of a taboo topic with a lot of third-party billers and payments, and it's we know that counselors
Could
who
you,
would
Dr. Lau,
do the
do you
same
mind,
diagnosis as.
Dr. Lau, do you mind repeating just this last portion, because we cut out?
Oh, okay, sure. I was saying about maybe it's taboo, but talking about third-party billers and payments, and at least some advocacy with that, because we know, for example, that a licensed mental health counselor, professional counselor, clinical professional counselor, whatever it's called in your state, that a licensed counselor who would provide a diagnosis of something that another mental health clinician might provide the exact same diagnosis, that clinician could get reimbursed higher than a professional counselor does. And for doing the same assessments, the same tests, if I'm going to give a depression and my psychologist colleague does the same one, they might get reimbursed higher. Oftentimes they do get reimbursed higher than I might as a professional counselor. And yeah, we're doing the same assessment, we're doing the same test, we came up with the same diagnosis, etc. So I think I'll see some greater advocacy in that area.
Yes, thanks for that. That's I think that's going to be like an issue of finally coming on par with other with our sister professions in mental health and behavioral field. That's, I wonder how long it's going to take, and I'm really crossing my fingers and prepared to do some advocacy in that field, as you know what I'm saying, as a professional, because yes, definitely that disparity feels heavy at times.
Yeah, and I can say that and it does sound like it can feel like, and it does sound like it's such a far ways away, but at the same time, when I was in my master's program, when I first started my master's program, not every state had licensure. Not every state had licensure, and it was when we talked about licensure, we talked about it from this faraway dream. Every state might have licensure. We talked about it that way, and we had homework assignments where we used to write letters to our state legislators, or we were writing to the Capitol Hill, advocating for council licensure. And now here we are, however many years later, and we do have licensure. So in all 50 states, so what seemed like a far away to not be as fast as some of us would like, but I think when you think about it, we actually have made pretty good progress. So yeah,
there's hope.
Yeah.
Yeah. Okay, so and the last question to kind of wrap it up. I'm curious about your bit of wisdom. So what would you like the master level clinicians who are freshly entering the field of professional counseling and of clinical work to know about assessment and kind of remember and keep in the back of their minds?
Something I like them to remember, keep in the back of their minds, as it relates to assessment. I think I would say one. I think I would say enjoy it. I think I'll say enjoy the process or enjoy the experience. I think it. Hopefully, maybe at the end of today, hopefully maybe there's a new, or if not a new, maybe a broader mindset with regards to how to approach assessment. I was really lucky, in my master's program. I was actually trained by a clinical psychologist, and and he was a big shot clinical psychologist, and he brought in all his own test kits from his own practice, and he would bring them in, and we had the full actual test kits, and we were doing, and they could be intimidating, but I remember he made it very applied and very fun, and I actually enjoyed it. I didn't know what I was doing. I thought I was a hot shot because I had to play with the ink blot. But but you said you're never gonna do this, and you're not qualified, but I just want to teach you, kind of thing. He would say this kind of stuff. But it got me interested, and it got me to appreciate assessment. And I think I would like to let folks know um, enjoy it, and I think that no one's expecting folks to finish their first semester, their only, take that one semester class in it, is expecting folks to be perfect, or expecting folks to be, flawless and know everything you need to know. And I think, when you're at your practice, talking with you, so much more fluid or fluent in the assessment language and field. I think I like folks to know that no one's expecting that. I think of a student to, at the end of the first or the one semester of it, I think not to say people have low expectations of people, but I think folks have realistic expectations, or should have more realistic expectations, to say that we want to see you work hard, want to see you try, want to see you process the material and do your best. And at the same time, you realize that you're not going to come out and be this amazing, amazing type of assessment guru. That'd be awesome, be wonderful if that was the case. But if that was the case, like we've all been doing it wrong for decades, and we haven't figured out that magic secret on how to teach it that way yet, or how to get the magical counselor yet. So but I think there's certainly some foundational things that folks need to know, but not to be intimidated by those things. Yeah, so I think I like, maybe that's my keep in the back of your mind, like learn it, enjoy it. It's okay if you make some mistakes, if you don't know it perfectly, but don't be complacent and strive to get better, I guess.
Yeah. It's almost like you just wrapped everything up of like, don't be intimidated, strive for competence, don't feel like you will be expected to move the mountains after a free credit course in your program, and just learn more and commit to something here, and to this like continuous and throughout the career learning, including the assessment, if that's what you're choosing to do.
Yeah. I guess the same could be said about every aspect of our practice as graduates of a master's program. And certainly while still in your doctoral program, if that's what someone chooses to do. But anything post-masters, right? As you pursue your license, as you're working to schools, as you are, in your communities and your agencies, continue to grow. And if someone might choose to pursue a doctoral degree, to continue to take that opportunity to then build upon it and just continue and get even better, you know. So,
Yes, thank you. That's like the optimistic note that I needed today.
you're welcome.
Yes. Uh, Dr. Lau, thank you so very much for your
Yeah,
time
yeah.
and for repeating this. Like I just, yes, I also kind of
Ah,
see you model in that, just this commitment to if something doesn't work, let's just do it again and let's try again. So I'm definitely taking that from our time together this time around.